All right, we're back for the last of our mini lectures for population growth and healthy aging. I like to break these up because I find that sitting still and listening to anybody talk for 40 minutes can be kind of boring. So we're just going to wrap up this last section starting by talking about visual impairment. This is a really common health condition in older folks that can have some really broad-reaching implications. We often throw around these terms like macular degeneration, but students rarely have encountered what that kind of visual impairment actually looks like. So I'd just like to show some examples. This is an example of macular degeneration, regular vision on the left, macular degeneration on the right. So think about some of the things that we've talked about in terms of the importance of physical activity in so many ways. And then imagine trying to be physically active in that environment with that kind of visual impairment. What would it do to your confidence in your ability to go for a walk, to walk to the grocery store a couple times a week for fresh fruits and vegetables, to get out and see people, to socialize, to engage with your community, when this is the way that your vision portrays the world around you. So easy to see how these kinds of visual conditions can be a really serious health concern, regardless of age. We just see them more often in older populations. All right, so this is an example of visual impairment. We can see that darkening and loss of focus in the center of the field of vision. Next, we're going to talk about glaucoma. So glaucoma, normal on the left, glaucoma on the right. We see that loss of peripheral vision, no longer able to see things around the edge of the field of sight. And this is a really great example because now we can no longer really truly see the bicycle here. And if you're walking up to the corner trying to get across the road, it could be a trip and fall hazard, which is more dangerous, of course, as we get older. So that's an example of how glaucoma actually looks in the field of vision. Next, we've got cataracts. Cataracts, we don't really see the loss of any particular part of the field of vision. It's more a loss of acuity. So instead of seeing clear, sharp detail, we see things start to get fuzzy, and it really gets difficult to tell. Imagine here now maybe trying to look down and see where the curb is, so you can step carefully over the edge. So with cataracts, we see that loss of detail, and that's our main concern with that visual impairment. And then finally, diabetic retinopathy. If you think about our really high levels of type 2 diabetes, diabetic retinopathy is an eye disease, eye condition related to being diabetic. And here we see the loss of vision, darkening of the visual field, but not concentrated to a particular area. So, if you think about things like maybe, trying to use a computer, dial a phone, much less get out and walk around, can really see how these kinds of visual impairments can represent a really significant quality of life concern for older folks. We talked a little bit about falls in terms of visual acuity. There's lots of reasons, lots of risk factors for this in older people. Loss of balance is not necessarily related to visual impairment, although they often go together. A really easy way that we can help to work on this is to fall-proof the home. So this means things like making sure that handrails are installed and easily reached, removing things like throw rugs, making sure that transitions between different kinds of flooring in different rooms don't have a step up or a step down, just a smooth surface. Improving lighting. Several of the visual impairment examples that we saw could be improved with better lighting. And then also regularly getting older folks in for eye exams, making sure that their vision is corrected at least as well as possible. Of course, once we do experience falls with this population, one of the things that we worry about is osteoporosis, which is that calcium deficiency that leads to overall weakening of the bones. So in addition to being more likely to fall, we're more likely to get seriously injured when we fall. And those injuries can have other implications as well. We do know that for injuries like broken hips, which become much more common in older populations, we do see increased rates of death in the months and years, really not up to years. If you can make it out to about a year, you tend to be in better shape, but in the months following the broken hip. And a lot of it really has to do with just that loss of mobility, losing all of those benefits that you get from physical activity when you're immobilized and recovering. So, back to our ideas of prevention, these are simple ways that we can help to keep our older population safer. Another thing that sometimes goes with the impairment of vision and also with hearing is social isolation rather. So, you're less likely to go out because you don't see as well. You're less likely to interact with other people. And our social networks are so vitally important not just to our mental health, but to our physical health as well. Thinking about losing your ability to drive in a city like Las Vegas, starting to depend on your family members to make sure that you can get around. You can see how that can be an important restriction and source of social isolation as well. Um, we know that keeping blood sugar in control for diabetics can help, especially with that diabetic retinopathy. Maintaining steady blood sugar levels, good glucose control, is an excellent way to help protect visual health. Again, screenings. And then just a point about hearing here. If we think about the relatively recent widespread use of headphones and earbuds, we are in a certain way running a generation-wide social experiment to see what the hearing is going to be like in a couple of decades. So trying to keep hearing health, keeping music volumes down, and then also trying to protect or trying to protect vision, really important ways that we can help our senior populations to stay healthy. Another important area of health for our senior populations is the idea of oral health. Let's take this back again to that idea of a healthy diet, right? We'd like to see everyone of all age groups eating as much, fruits and vegetables as possible, keeping the produce portion of their diet up. Now, how does that work if you have lost many of your teeth, right? You may have moved to dentures. That may help a bit. But that implies, having access to a certain amount of resources. And then sometimes if the dentures don't have a good fit, or if you don't feel as confident in them, you may see impairment of diet quality with that as well. This is a great opportunity for prevention. And adequate dental hygiene in younger years helps to preserve oral health and preserve teeth. But we do have some access issues, not just with dental care, but also with hearing care and vision care. Medicare, so our primary insurance program for older Americans, doesn't cover any of these areas. So often we see lower income seniors who are in a really difficult spot trying to maintain these areas of their health without the ability to pay for the care that they need. We, of course, have to talk about the really important issue of dementia, Alzheimer's being the most common disease in this category. Every 67 seconds, someone in the U.S. develops Alzheimer's, so it's very common. And actually, some of us in our class may actually have an older relative who's experiencing this at this time. We do know that although there are some early onset cases, in general, risk increases with increasing age. And we do see health disparities at play here as well. Twice as high diagnosis rates in African Americans, 1.5 times as likely among Hispanics. When we look at some of the other kinds of conditions that we worry about, like breast cancer, having recently finished our Breast Cancer Awareness Month in October. So about 1 in 10 or 1 or 11 women likely to experience breast cancer in their lives. About 1 in 6 women are likely to experience Alzheimer's after age 60. So really a very widespread condition. And one of the things that can be underestimated is the burden that this places on caregivers. What it takes to truly take care of a family member who's in this condition. We've got another health disparity at play here as well, in that the number of women who take care of family members in this condition, 2.5 times more women than men take care of or are placed in these caregiving positions. If we look at the dollar cost, so moving on from the quality of life cost, but the dollar cost, more than $200 billion a year in long-term care for people in this condition. We do have some exciting prospects in terms of Alzheimer's prevention and treatment, so this would be a good one to keep an eye on over the next couple of years. One of the things that we're looking at is the relationship between lifestyle choices and Alzheimer diagnoses. We do see some interesting relationships where quitting smoking, maintaining a healthy weight, maintaining good physical activity levels, treating conditions like high blood pressure and cholesterol, these can really, it seems, start to have some impact on our Alzheimer's diagnosis rate. So yet another way that we can look to improve lifetime health outcomes by improving those important risk factors. We don't yet have a cure, but some of the newer medications that we've found are actually delaying the progress of the disease. This is, not the ideal situation. It would be better to, give somebody a diagnosis and give them a treatment plan that's going to get them back to full health. But at least if we can delay that onset, if we can keep somebody functioning at their normal level for a few more years, we can really reduce that burden on the family finances, and then also our larger scale burden of the financial cost of this disease as well. Often we find people with Alzheimer's ending up in long-term care. This is not something unique to Alzheimer's, of course, but it's not something that we really have a comprehensive plan for in the U.S. Medicare, that federal insurance program, doesn't pay for long-term care. This is typically handled by Medicaid. This, of course, is the program for the needy, and this is the one that's paid for primarily by the states. So, for better or for worse, you do need to be below certain income thresholds to qualify for Medicaid. The good news, bad news is that if you end up in a long-term care without being prepared for it, that it's going to drain your assets quickly enough that you would rapidly become poor enough to qualify. Think about that graph that we looked at a couple of classes ago when we were talking about healthcare expenses. If we look at the number of people who are enrolled in Medicaid, the elderly represent about 10% of that population. But they do use a full quarter of the budget, typically for long-term care. And if we include other folks in need of long-term care, about a third of all Medicaid spending is spent on long-term care, which really wasn't the purpose for the program was designed for. If we look at social trends, we see fewer and fewer family members who are able to care for their elderly relatives just with changing patterns of housing and employment. And again, it comes back to this idea that if we can do more prevention earlier in life, that we'll end up with better outcomes. So that is the end of our new content for PBH 205. I really enjoyed working with you all this semester, and I look forward to seeing you next week to see the topics that you'll be presenting for your research papers. So wrapping up our lecture topics, we started talking about population growth, and then in the second half of our lecture we talked about aging. So we know that the American population is living longer, which is really great news from a public health perspective, but it's also expensive because the older we get, the more we spend on care. If we continue in our current direction with no change, we do expect that in the next several decades that we will overwhelm the system, so that by the time folks in your generation are ready to access that care system, we don't expect there to be a lot of funding left, at least if we continue with our current trends. Really, the best option in so many ways is to help work on quality of life for the elderly by reducing those chronic disease rates with so many of the prevention ideas that we've talked about over the course of the semester. Please remember to complete the population growth worksheet that's also in the same folder as these videos before our next class. When we return from Thanksgiving, you can submit that online as usual, or a hard copy in person, whatever works best for you. I hope that you are having or have had a wonderful holiday, and I look forward to seeing you when we return.